The Indian political ethicist Mahatma Gandhi once said, "Health is the real wealth, not gold and silver pieces." Health crises can destabilize nations and regions, disrupt economies, and exacerbate existing social and political tensions. This panel will discuss how health security can be better integrated into international and regional agendas, drawing lessons from recent crises. Welcome to the panel, Global Health in Crisis, New Frontiers in Preparedness and Equity.
Here we are. So good afternoon, everyone, and welcome to the panel number 10. So the title, as you already know, but to repeat is better, is Global Health in Crisis, New Frontiers in Preparedness and Equity. So my name is Benedetto Zacchiroli. I'm the president, and I have the honor to serve as president of the European Coalition of Cities Against Racism. And so ECHR works to support cities in developing inclusive policies that combat discrimination and promote social cohesion. The link between our, as ECHR, work and today's discussion is clear. Health crises not only challenge healthcare system, but also exacerbate existing inequalities, disproportionately affecting marginalized communities. Ensuring equitable access to healthcare and strengthening global health security are crucial steps in building more resilient and just societies. Before we begin, I would like to take just a few seconds, just one by one, within us, to remember the many lives lost during the COVID-19 pandemic, a crisis that not only reshaped global health priorities, but also deeply affected our communities, and even led to the suspension of one edition of our global forum, if I don't get wrong. So their memory reminds us of urgency of our work today. So just 10 seconds of silence just to remember them, please. Thank you. So as we witness how the COVID-19 pandemic and other health emergencies have underscored the vital connection between global health and security, we are gathered to explore how institutions like the WHO can be empowered, how equitable access to resources can be ensured, and how resilient systems can be built to prevent future crises. I'd like to start, it will be really easy. I'm a humble moderator. I'm already finished my speech, introduction, and everything because time is running and it's better to listen from them than from me. I just have to remember you that after this panel, there is the youth panel. So we have all to stay here after this really interesting panel because youth are speaking and we promise every edition of the forum to stay and to listen to them, and we are to feel obliged to listen to them. So don't forget that. So I'd like to start with a general question for all the participants, the panelists, sorry. The question is this: in light of the challenges posed by pandemics, antimicrobial resistance, and climate change-driven health threats, what do you consider to be the most critical reform or measure needed to strengthen global health security? And how can we enhance international collaboration to ensure a more effective, equitable response to future crises? So, I'd like to give the floor as first to Teymur Musayev, sorry for the pronunciation, is the Ministry of Health of this beautiful country that is Azerbaijan. Please take the floor. Thank you so much.
Thank you. Your Excellencies, distinguished guests, ladies and gentlemen. Really, in recent years, global health has experienced both advancements and setbacks influenced by factors such as pandemics, environmental changes, and healthcare interventions. Challenges often push countries to innovate and grow stronger. Rather than viewing obstacles as roadblocks, they should be seen as stepping stones to progress. Global health crises, such as pandemics and disease outbreaks, are devastating, but at the same time, they also create opportunities for positive changes. These crises drive urgent innovation in vaccines, treatment methods, and medical technologies. They also expose weaknesses in healthcare infrastructure, prompting countries to implement stronger policies, enact reforms, and increase investments to better prepare for the future. Under the leadership of His Excellency President Ilham Aliyev, the implementation of socially oriented policies, transition to digital government, and economic diversification have strengthened our sovereignty and solidified our position as a leading nation of the region. As emphasized by His Excellency, unanimous decision to hold COP29 in Baku last November reflects the international community's deep respect and trust in our country. COP29 conference has been remarkably successful and productive, leaving an enduring legacy in the history of the climate change movement. Reducing the impact of environmental pollution on human health and promoting a healthy lifestyle are key priorities for the Azerbaijani government. Given that climate change is ongoing and unlikely to be reversed in the foreseeable future, we must prioritize mitigating its health impacts. Key actions include building low-carbon sustainable healthcare systems, developing green hospitals, and preparing a climate-resilient health workforce. These are vital components of sustainable and healthy future. Dear esteemed audience, the future of health systems will likely be more predictive, personalized, and participatory. The healthcare industry will be shaped by a combination of technological advancements, data-driven decision-making, and shift toward personalized medicine. We are at a historic turning point, actually, at a time when the world is facing a shortage of healthcare professionals. A new colleague, artificial intelligence, is joining us. We are fortunate to be part of a generation that can solve long-standing healthcare challenges once and for all through AI-driven solutions. One of its most significant contributions will be expanding access to medical services, particularly by strengthening primary healthcare services. Using AI as a family healthcare guide can be helpful for monitoring individuals' health and offering lifestyle recommendations. Even today, AI, big data, and digital solutions play a crucial role in improving healthcare services. To fully integrate these technologies, it's essential to incorporate AI into legislative frameworks to ensure its responsible and ethical use. However, as we integrate AI into healthcare, we must ensure fair and unbiased use of AI-driven decisions through appropriate regulations and ethical guidelines. The future health policy should prioritize data security, patients' rights, and AI governance to prevent cyber threats and misuse of sensitive medical information. While digital tools offer immense benefits, they should complement, not replace human interaction. These technologies should serve as supportive tools, enabling healthcare professionals to dedicate more time for direct patient care. At the end of my speech, I would like to reiterate the key idea I shared at the beginning. Every crisis brings new opportunities. Throughout history, humankind has made incredible leaps forward only by overcoming crises. The nature of this crisis may vary, but they always serve as a catalyst for progress. I would like to conclude with an aphorism from the great sage Nizami Ganjavi. In the hour of challenge, do not lose hope. Pure crystal rain falls from the darkest clouds. Thank you for your attention.
Thank you very much, Minister. Really, thank you. And then the idea of the primary health care is absolutely fundamental, and a primary health care for everyone. Because as one said once, if you start from the last, you take everybody. If you start for the first, it's not sure that you take everybody, so it has to be universal. Anyway, let's go and pass through Madam Greenfield, so member of the House of Lords and Senior Research Fellow. Your question is exactly the same. Please, the floor is yours.
Okay.
And thank you very much to be with us.
Well, first of all, I'd like to thank the organisers for the invitation to this meeting and the opportunity to speak on this absolutely vitally important topic. What's not in the blurb of the programme is actually the central day job that I do, which is as a neuroscientist. So I'm going to answer your question through the prism of neuroscience. Someone said to me a day or two ago at this meeting, well, actually, neuroscience is at the heart of everything. And I hope you would agree, because what is essential to all our thoughts is you as a person. And that is what it comes down to. Your well-being, your consciousness, your individuality, getting the respect that you deserve, the opportunities you deserve, the healthy lifespan that you deserve. And as a neuroscientist, this is what fascinates me, is this notion of the individual, the fact that for the 100,000 years we've stalked this planet, there's no one like you. Even if you're a clone, that's to say an identical twin, no one is like you, nor will there ever be again. So this essence, this individuality is something perhaps we take for granted, but it's really important. And I see the global health crisis, and this cuts across all politics and nationalities. There's two issues that are very central that I think are imperiling that individuality at either end of the age spectrum. The first is the impact of the screen technology on young people's brains, on how they think and feel. And the second, at the other end, is what I actually work on, which is the spectre of dementia, of Alzheimer's disease. Should I take a minute to talk on each of those things? I don't know how long we have, yeah? 1 minute on each, okay. So the reason that it's so important to consider young people's brains and the impact of the cyber world is that the human brain is wonderfully what's called plastic. That's from the Greek plastikos, to be molded. It doesn't mean it's made of plastic. So the human brain is superlative in its adaptability, which is why we occupy more ecological niches than any other species on the planet. It follows, therefore, that every minute you are alive, your experiences are going to literally leave their mark on your brain. And so ever since you're born, you are going to evolve a unique, personalized brain thanks to the plasticity of your brain cells. It follows that if you live in a world of primarily 2 dimensions and only 2 senses, as opposed to 5 senses and 3 dimensions, you might see the world very differently, you might think and feel very differently. That's obviously not something we can go into on this panel, but it is a huge issue, not only to all of us, but especially to young people who don't have any sales resistance, whilst those of us born in the last century have the backup of all those experiences, all those real-life experiences, which enable us to evaluate the world and to navigate it and have a retaliatory response to the screen technologies. Someone who hasn't had that privilege may be much more vulnerable to being manipulated, by being constantly driven by outside stimulation. In fact, there's an experiment where young people were asked just to sit still for 10 minutes, and they found this so aversive that they preferred to administer electric shocks to themselves. So I think this is a real issue, something I'll be delighted to talk about offline later, but that is the first one. The second one, which is dementia. Dementia is not a natural consequence of aging, but it is a disease of older people. At the moment, there is no effective treatment for it, and much too much money has been subverted on a bandwagon of drugs that are antibodies to something called amyloid, which is a downstream component. What we work on is something upstream and try and understand why these cells embark on this slow death, which is not natural in biology. So what we need is a way of you reading out a biochemical measure that perhaps is a saliva test or a lateral flow test that tells you the damage is underway already, because there's a 10 to 20 year time window before the onset of the so-called cognitive impairment. So what you need is some kind of readout that you can do at home, a screen that sends you to the doctor, a saliva test that would perhaps give you an early pre-symptomatic diagnosis, such that you could then have a drug which, if it works in humans as it does in mice, in our case, then, and that's a big if, would stop any more cells dying, which means if you took the drug before the onset of the symptoms, then you'd never get the symptoms. So that is a very crude overview, Mr. Chairman, of on the one hand, the problems we are uniquely facing this century, screen technologies and dementia, because people are no longer dying of TB and cancer so much. But on the other hand, the fact that there is the chance now for true innovation, but we have to take the foreground, we have to take risks, we have to challenge dogma. But I think it could be an exciting time for the first time this century, recognizing ourselves for the unique human individuals that we are. Thank you.
Thank you very much, and thank you also because you were really fast, and we appreciate that, just to have more voices and more contribute. So thank you very much also about, and above all, about the approach. That is an approach, a new neurologistical approach to diversity, that each of one is absolutely a testimony of diversity of the world. So, thank you. We shift to somebody that is, I can introduce Ismail, so you are more host than me on this stage. So, please, the question and the floor is for you, please.
Well, thank you very much. I have 5 points that I would like to make in this very opening statement. Number one is to be clear that public health is not the same as private medicine. If I have to get a tumor removed, I need the best quality medicine. But that's private medicine. Public health is how the whole population of a territory or a country or a region is living and how healthy it is. And that requires a different set of concerns and statistics. In fact, in dealing with public health, for example, most people would not necessarily think of that, but one of the greatest major contributions in the history of public health was done by engineers. Clean water and sanitation in the cities. That was a major transformation that helped save a lot of children. And thus, we need to think of that. So the second thing in dealing with public health, as well as medicine, is that prevention is better than cure. I just mentioned water and sanitation, but there's also systematic vaccination, MMR, for example, mumps, rubella, and measles and rubella, now when it's given to almost all children, has pretty much eliminated many of these once terrible diseases. And we should also encourage nutrition. Proper nutrition is essential, especially of poor mothers in the remote areas, because first of all, they will have full weight babies. Secondly, they will be able to breastfeed. Thirdly, that covers the period of the brain development of the child in the last part of the pregnancy and the first 6 months of life. So that's all very, very important. So the third part, I think you mentioned, Mr. Chairman, when you said primary health care at the community level. That is absolutely fundamental, because that's where the first responders are, and that's where the first manifestations of problems exist. And today, with telemedicine and AI, we have a possibility of reaching and creating networks of communication that were not possible in years past. That brings me to my fourth point, which is about the need for global monitoring. And there, I think it is almost unthinkable that after what we saw in COVID and at the risks that exist from avian flu and other manifestations, where we expect with climate change there will be new vectors of disease, plus, of course, the fact that viruses mutate and then can shift from species barriers and reach humans, that the United States would pull out of WHO. I mean, if we didn't have WHO, we'd have to invent it. We need a central global platform that maps and monitors everything that's going on around the world, keeps everybody informed of what is going on. And that will just be not just to avoid the past pandemics, but also to learn from others. And for that, we need to strengthen WHO and give it a solidified fund from which it can intervene in all these different areas, including, of course, community-level primary care. And last, the fifth point I want to make is that there has to be a much greater commitment to better sharing, although everybody said during the COVID campaign that nobody's safe until everybody's safe. Actually, we all know that the distribution of vaccines, of therapeutics, and of tests was not at all equitable and that we need to address that in the future and learn from that thing. Last, I will also mention that I'm glad you had this few moments of silence, because contrary to the public figures that were published about COVID, where it was estimated that 7 million people died, actually an ex-post statistical analysis showed it was closer to 30 million, 4 times as much. So it was a devastating pandemic, and we need to do that. And whether it was originated in a lab or originated naturally doesn't make much difference, because we know that gain-of-function research is going on in a number of labs, and we need to have global regulations on how such dangerous activities done on modifying viruses' capabilities are being done by who, where, etc. So with these 5 points, I think that's how we can move forward toward addressing global health for everybody.
Thank you very much. Really, thank you. Above all, if I may underline the idea that Ismail, if I may call you like this, underline for us, remember us that the health system is not just a doctor or an hospital, but is a system that's begun before to come to the hospital or to come to the doctor, is made also by infrastructure, is really a complex system that we have to take into consideration when we approach all the discussion about health and health system. So, thank you one more time. Then, Chiril Gaburici, that's the former Prime Minister, of Moldova. So, your perspective and according to the question. Thank you very much.
Thank you, Chairman. I would like to start by thanking Nizami Gencevi International Center, including the board members, of having all of us together over here and having the opportunity to share our thoughts, discuss the global challenges that we are facing, and one of the challenges is the healthcare. The global health crisis, I don't see it only as a medical problem, as Chairman mentioned. I see it actually that it reflects some deeper crisis. First of all, in communication, in cooperation, and in understanding. It's obviously that we know the knowledge, there are access to the technologies all over the world. And yes, we do. We have enough financing, but we set up the wrong priorities. That's how I see the things. Also, one of the major challenge is the illusion that we live or exist in isolation, and that our national interests are separate, I would say, from the well-being of the world. And with this sort of mindset, it fuels us to have increasing of the division and the competition. It's not just the lack of medical solutions. We passed through COVID-19, we passed through pandemics. Did we manage to learn the lessons? Are we going to act different if now something like that would happen? Are we managing to make sure that logistics and infrastructure, that it was mentioned a couple of minutes ago, is ready to serve another situation like that? I think I will give a short example. While we have to invest in healthcare, that financing are stagnated, at the same time the investment and the financing of military equipment increased in the last 2 years by more than $1 trillion. At the same time, the diplomacy is using a strange vocabulary. We are using the wording like forcing peace, the wording like aggressive neutrality, and this all is a complex problem that is affecting the healthcare crisis. At the same time, we have small countries or poor countries that are struggling to get funds. The decision of distribution is not equal, I would say. The results of all this, we have more life or more people dying, and it's not only in the wars, but it's also in the hospitals that are lacking the resources, also in the communities that don't have access to medicaments, and also in the countries, like I said, which are left without the global support. The former President of the United States, Ronald Reagan, said that peace is not the absence of conflict, but the ability to manage conflict by peaceful means. And I would like to say that if we truly want a healthier world, then we need to change the approach, not just in the healthcare, but in the setting the priorities. It was mentioned about infrastructure on top of hospitals. I would also add the supply chain. I would also add the production of the medicaments as well. And they should be somehow distributed in a way that in case of emergency to have easily access of it with the right and proper logistics. We mentioned about COVID-19. I think there is a real case to be studied and to understand what we can learn out of this, what were the real challenges that we didn't find a solution yet. When we talk about WHO, I think it's very important to have an efficient working in terms of policies and in terms of the right protocols, as well as access to the medical services and medicaments. Today in the morning, in the first panel, it was mentioned by Bernardo Mariano that private sector has to be involved more in technologies and artificial intelligence. I think that's also the case for the healthcare. We have to invest more private sector into the healthcare, because wherever private sector is involved, the things are moving faster. It's tested many, many times. At the same time, the public institution has to give the right support to the private sector in terms of licensing, in terms of less bureaucracy, I would say, or in terms of more or less taxes, I would say. More advantages for them to invest. And we have to learn to work together. We have to work together in finding the solution in the researches, but also in reacting to the crisis. Me, representing a small country, I see the global instability, something that makes progress for small and poor countries even harder. When the big nations are focused on military power instead of health security, small nations suffer first. And small nations are the ones that desire peace the most, I would say. We are living in a strong and powerful humanity. We are very strong today, but the humanity is not kind enough. In order to be able to continue, unless we don't realize that it's not important how much power you have, but how we are able to use this power in order to construct a healthier and a better world for all of us. Thank you.
Thank you very much. I think that can underline that when you say we have to set up properly the priorities, and I heard your setup of priorities, that is like that you ask for a more serious and effective approach, because all the, let's say, politicians, the people in charge of that, they are saying that are the priorities, but setting up in the order you said, that means seriously, to be a serious approach, to have a serious approach. But let's shift to the next panelist, that is Madam Dalia Itzik, that is a friend of us. And so, floor is yours for your 3-ish minutes. And we are on time, so thank you very much for all.
Thank you very much, dear Benedetto. Good afternoon, distinguished colleagues. I am honored to participate in this panel as the chair of the board of one of the largest hospitals in Israel. The issue of global health is extremely important, as well as we know that the world will continue to face such challenges, especially in light of pandemics, climate change, and the introductions of different health policies worldwide. So in order to address this issue from a global perspective, I think about a few imperative conditions that we have to face. International collaboration is so important. And as you all know, germs don't recognize borders. So exchange of lessons learned and experience gained among nations is very important to spread the knowledge between your neighbors and continue of medical technology and research. So one of the things that I thought, of course, is medical innovation. It's very help. The other thing is, unfortunately, we in Israel also have emergency events for decades. So also we, because of that, demonstrate incredible resilience and flexibility under the extreme circumstance, like the COVID-19 or the break of the recent war. Our medical teams are experienced and skilled, and the operations runs relatively smoothly. I just want to remind that someone can ask why Israel was the first country to vaccinate. Why? And I think that one of the reasons, or maybe the main of the reason, is that the Israeli healthcare system infrastructure is located in the communities. So you don't have to come to the hospital. You have in every community, every neighbor, you have your clinics. You can go there and immediately control the situation. So because of hundreds of clinics in the country, so this allow us for a swifter response for everyday medical concerns and provide a sense of security of the population. Also, we encourage during the COVID-19 to tell our doctors, fly, try to learn, give them the protocol. We have here with us, with the panel, Professor Yoram Weiss, who is running the largest medical organization in Israel, and he is by himself was responsible for the protocol of the world, that how to treat and what to do. In such situation, you have immediately, rapidly to give answers, which is so important to such a situation. And you know that I don't think that I renew something by saying that infrastructure, medical innovation, international collaboration, industry of clinical activity relations with the world. I think this is very important. Much more important is health equity, that everybody, Christians, Muslims, Jews, they can get the same treatment exactly on the same time. So we're very proud in our hospital about our coexistence. We have doctors from all the sectors. We have patients from all the doctors, from all the citizens. So we are very proud of this. And the more we collaborate, the more we participate our knowledge, we will bring a good message to the world.
Thank you very much indeed. I'd like to stress the idea that you give to us, first of all, about this approach that has to be international without boundaries from research and so on. But also, sorry if I really move too much my hands, but I'm Italian. And so this is, thank you. And sometimes happen that there is a fan of Italian way of speak, and this international, but also the localization of the health system around the country that's allowed you to be faster in the emergency and so on. I shift now to Amir Dossal, another friend of our forum that is here with his wisdom. So please take the floor.
Thank you. Let me start by thanking our friend at Nizami Ganjavi for hosting this amazing forum. I've had the privilege of participating from the first one onwards, actually, I haven't been here for 12 years altogether, but it is amazing how it's evolved, and it's really a platform for intellectual dialogue, critical exchange, ideas, and some actions also take place. I love, Madam Itzik, what you've been saying about the health system in Israel. Israel has been helping many other countries as well. And what the distinguished moderator mentioned about international collaboration, I'm afraid it doesn't always take place. Some countries do it as a matter of course. Israel and many other European countries do it. But we're also losing that togetherness concept which we used to exist, that let's find these solutions together. So we need to be thinking a little bit outside the box and saying, we should have national ownership of the health agenda. Currently, there's a lot of dependency, especially amongst the lower income countries, the middle income countries, where they rely on foreign aid. They rely on, if you like, foreign guidance. I think foreign guidance is good. I'm not sure about foreign aid. Yes, they cannot buy the right equipment. They might not have the right dispensary. They might not have the hospitals. But we need to find a way to turn the challenge on its head and say, let's move that problem away from international organizations, bilateral aid systems, to national ownership of the problem. We heard the amazing work which Azerbaijan has been doing in the health sector. We heard early on what Azerbaijan has been doing in the AI sector. These are the kinds of models where Azerbaijan and 24 other countries can share their expertise. Like Israel is doing, other countries can do the same thing with countries who desperately need it. The statistics are stark. There are 700 million people suffering with malnutrition. We're not addressing the issue of prevention. When we talk about health crisis, we often talk about short-termism. How do we react to COVID-19? How do we react to pandemics? I think by national ownership, we increase the possibility of prevention methods as well. And maybe later on I can go into some specific ideas, if I may, Mr. Chairman. Thank you very much indeed.
Thank you very much, and thank you also to remind us to think outside the box and not to stay stuck like, okay, it's always like this and us to be forever in this way, but to have this attitude. And I have to thank, before to shift to the last panelist, the other panelists and all the panelists, because it was so consequential what you said, that or you had a secret meeting before and you take an agreement, because it's fantastic till this point. And I'm sure that we were not deluded by the last but not least panelist, that is Yoram Weiss, please. And maybe he will give us a spoil about something. I don't know if there is this spoiler. I'm waiting for that. Thank you.
So, thank you. And once more, thank you for inviting us. I would say the following. First of all, we need to look at the scientific environment that we're facing. And it's not only the demographics in the world that is changing, but also the science is changing. And the science is making also the possibility of an outbreak of a new pandemic a possibility. And we need to be aware of that. But also our overuse of antibiotics. And the reason is that our use of antimicrobials is very problematic because we use it too abundantly. And we're basically driving microbes to become very, very resistant. And we see it now currently with tuberculosis and others. So we need to be aware of that. The other thing I think that we learned in COVID, and as Mrs. Itzik mentioned, I'm running one of the largest hospitals in Israel, but in Jerusalem, the largest one. And I should say that what we saw really, what was extremely important, is Jerusalem is a very heterogeneous city with many communities that are there together. It's very important when you deal with an outbreak is to understand the social and cultural barriers and to communicate with the community. This is extremely important in order to be able to intervene. Having said that, no doubt that the fact that we have a universal healthcare, that universal healthcare is both in the community and the hospitals, provides us the information that unfortunately many other very developed countries didn't have at their hands at the outbreak of COVID. I think sharing the information, we were able to share it, and I would say that we were also able to create a task force within the hospital, and this task force wrote COVID guidelines much earlier that larger institutions wrote them, and what we did is we immediately distributed on the internet globally. We translated it into Spanish, French, and English, and distributed on the internet, and I can tell you that many institutions all over the world used our guidelines before the organized international medical community stepped in. I think that not only visits, but also telemedical consultations or protocols and consultation through telemedicine are possible. And the most important part is maybe for the international community to understand is when we have the next outbreak, no blame, no shame, because we want to know of the outbreak as soon as possible. And it can occur anywhere, any moment, or maybe in 100 years, like happened with the Spanish flu and COVID. But we need to say no blame, no shame. Thank you.
Thank you very much indeed. And so I will stress finally that idea to remember us to really overcome the social barrier in the health system and take into consideration. But running toward the second round, I have a specific question for each of our panelists just to merge this general topic that we have as a panel with their specific background. Let me start with the Minister. So, from your perspective as a national health leader, what are the primary challenges and opportunities in integrating global health security measures into your country's healthcare system, and how might these experiences inform broader international strategies, please?
Thank you very much for this question. Actually, Azerbaijan was always open for integrating international security measures, especially in the health sector, and good proof of it, all the actions and measures that was undertaken in Azerbaijan during COVID-19 pandemic from the first days. As we recognize one international health body, I mean WHO, the World Health Organization, the main integrative platform through which all the countries could collaborate, especially during emergency cases, during situation when the global health needs consolidation and full collaboration. This kind of collaboration during COVID-19 pandemic was done perfectly in Azerbaijan, and I'm proud to tell you and to answer to the first part of your questions that we have no challenges in implementing this part. But regarding the second part of your questions, Azerbaijan initiated a couple of ideas regarding upgrading already existing international system of information exchange as creating unified platform, I mean digital platform, to be managed by WHO. And also we promoted the idea of having WHO Academy as a main continuous medical education platform, especially when we try to promote the idea of influence of climate change on human health. So these two directions, and as I mentioned before during my speech, implementation of all the capabilities related to use of AI within healthcare management system, not only the medical ideas, I mean the point of view. So the healthcare management systems powered by AI would provide incredible opportunities for health, for global health system. When we say the global health, we mean as a responsibility for whole global health, not just the bilateral or bilateral bilateral contacts or some relationships within the international organizations. So global health is responsibility for every country that support the idea of international collaborative platform in order to prevent any future threats and challenges that we can face. No one secure from that. And we already have this platform. It's WHO. Do we need to upgrade it? Let's do it. We see the idea of empowering certain bodies as strategic approach, not tactical. With tactical approach, you can win the battle, but not the war. That's it. Thank you.
Thank you very much. Really inspirational and really full of hope. Thank you so much. From the Italian perspective also, because really, first, the AI is absolutely crucial. We don't have to recall, one of us, that during the pandemic, for the first time, humanity saw a vaccine find in this fast way, that thanks to the technologies and so on, but also of this kind of cooperation that can be enhanced, as you said, with something that we don't have to reinvent the wheel, because WHO is already there, has to be improved, for sure, like everybody of us. But so, let's go. Thank you very much indeed. So, Professor Greenfield, if I can say like this, because your approach is like this. So with your extensive background in bridging science and policy, how can we better translate cutting-edge scientific research into actionable policies that improve health surveillance and enhance global health equity?
Okay, thank you very much. So I think I can give you a very quick, easy answer, and then I'll elaborate on it. The quick, easy, one-word answer is money. Because science doesn't come cheap and it can't be done on the cheap. And it's in the real world, it's not dealing with ideas, it's actually dealing with experiments where you have contamination and breakages and just very practical issues. So it costs money and time. And I think the extended answer is how one can facilitate and make sure that the money is being appropriately spent. I think there's two spheres where we could see better interaction. One is internationally, and why I've been very privileged to have spent a few days here in Baku is, as well as meeting with the minister, I also gave a lecture at the medical university where we discussed the possibility of collaboration, which I gather is only just getting off the ground in Azerbaijan. And I think the more, especially young people, can come to laboratories such as mine and we can interact, then obviously that has to be a win-win situation because science is an international endeavor. And the more you have people from different backgrounds, seeing different perspectives and different cultures, the more you're open to exciting and innovative ideas, which in turn leads to good science. The second sphere, which needs a lot of attention, and I can only really speak for the UK, although a little with deference to Israel and also the US, where you're much better at it than we are, is the transition between spinning out companies from universities and... spinning out companies. So I myself was at Oxford University for decades, but then I had an idea and I patented it, and I now have a company, so I made the great jump to the private sector, but it's been a very sharp learning curve, and it hasn't been easy. And as I say, other countries have much better relationships in terms of how the universities can transfer their intellectual property. And that is the way you're going to get products, is at the end of the day, it's not necessarily in universities. The universities should feed the companies. And I should say a brief word touching on gender. In the UK, only 2% of VC funding goes to female founders. So I think someone should perhaps look at that a little bit more thoroughly. So to summarize, as always in life, it all comes down to money. I think that if we can fund or see schemes for international collaboration on a much more vigorous level than we do at the moment, that will actually lead to much more exciting, innovative research. And then all that research that's going on in universities shouldn't go to waste. There should be the facilities and the machinery and the willingness to fund a much wider, diverse range of research than people might be too scared to fund at the moment. Thank you.
Thank you very much. You also summarized by yourself, so I don't have to summarize by myself, but money is always important. So money, money, money. ABBA song, let's say, is the ABBA scheme. So money. Good. Ismail, please, what did we learn from COVID, really? And what that is help us to go ahead?
Well, I was very privileged to be a member of the Lancet Global Commission on COVID. And we looked at all the failures of the way the world responded to the pandemic. And among them were the delays in getting information out, the delays in declaring it as a formal pandemic, and how this could in the future be done better by having a much more established monitoring system internationally, because whatever happens anywhere in the world can be transferred now halfway around the world by somebody traveling in an airplane in a matter of hours. So it's no longer that simple a situation as it may have existed in earlier periods. Secondly, that, as I said earlier, if the WHO did not exist, we would have to invent it. We need that central overview that can share information, provide a platform that everybody can relate to and know what's going on at all times, and then deal with it. And in that sense, we need to strengthen the role by agreeing to the pandemic agreement which is being proposed right now to learn the lessons of the past. Third part is certainly that we had terribly unfair system of distribution of vaccines, therapeutics, and tests, which are needed everywhere in the world. Even though we declared and we said that nobody is safe until everybody is safe, that was a nice slogan, but actually that was not the case. And we now know that 30 million people died, not just 7 million people in that pandemic. So strengthen WHO, give them the fund that they have to support the work that is being done from the basic community level first primary care to the more advanced sharing of research results around the world that deal with the new risks of pandemics, and also to facilitate the equitable distribution of vaccines, therapeutics, and tests. Last but not least, you mentioned the speed with which the mRNA vaccines were developed. Well, actually, they've been worked on for quite a while, whether it was the BioNTech in Germany, which was Pfizer's vaccine, or the Moderna vaccine in mRNA in the United States, it was there. And that, if you go back to some of that, we need to encourage the research, whether in the universities and so on, and what people like me refer to as curiosity-driven research. And people say, well, why are you studying this? Why are you studying that? Well, just to give you an idea, probably the most successful new drug that is now on the market globally is Ozempic and other such drugs that initially were for type 2 diabetes and are now being used for obesity drugs. Nobody knows that it's part of that was discovered through research on the enzymes in the venom of a lizard, the Gila monster, 30 years ago. And that researchers were, why are you doing that? Well, we want to know more about what the hell is going on in this. Well, that later on triggered some other findings that well, that's similar to what happens in human beings, this structure, chemical structure that is there. And one thing led to another until somebody was able, in fact, to develop something extremely useful. So we must not refuse to fund that. No, we must also be funding the research and the science as much as we fund the primary care in the community level. Thank you, sir.
Thank you so much. So monitoring, researching, caring, equality, sharing, that are all words that is a puzzle that figure exactly what we need. Thank you so much. So, Mr. Gaburici, based on your experience in national leadership, I'm running because 6 minutes is not fair, because 6 minutes is not till 3:30. That is okay? So, based on your experience in national leadership during crisis, what policy measures do you think are crucial for strengthening regional collaboration and building resilient health systems, particularly in regions with limited infrastructures?
I would come back to the conclusion that I said before about the infrastructure. That's a must. Again, I'm talking about hospitals, supply chain, and production of the medicaments distributed properly to have quick access to different regions. Private sector to get more involved. Efficient distribution of the financial support. I for sure should mention the fact that Madam President also mentioned that we have to be able to have the international collaboration. And the example Mr. Minister gave, I can give from the same example from my country. When COVID-19 started, our medical system was not ready to fight with it. So what WHO was doing at that time, they were having these weekly meetings, video meetings, where our Ministry of Health was discussing, they were discussing, trying to understand, sharing the cases, getting the protocols, and getting the knowledge from, let's say, a WHO headquarters. And this is about, I would call it sharing the experience, the support that we needed. Also made, or it makes the small countries to feel a part of a big group and not left, not to be, not feeling not left alone. But if we truly want to have a resilient health system, then it's about priorities. Cooperation versus competition, prevention versus reaction, and equity versus the privilege. Thank you.
Thank you very much. So you summarize at the end. I don't need to do that. So, Madam President, reflecting on your unique experience at the intersection of politics and healthcare, how can governance and policy reforms be optimized to support robust health security frameworks, and what lessons from your tenure can be applied globally? You already mentioned something before, but now we can.
Benedetto, in your permission, I would like, we have a short memory. I just want to remind all of us, when we were stuck at home, not going to workplace, stuck with the children, if we have a child or husband or wife in the hospital, we cannot come to visit them during the COVID. And the mental crisis were so hard. So immediately, what we try to do, we realize that we have to put together the health care and the mental care that goes together. How we can treat the family, how we don't let the husband to see his wife, she's in the hospital 2 weeks, but he cannot visit us, otherwise he will be ill by COVID and stuck also with illness. So the mental and the approach of the other family, holistic approach to the other family was very crucial there. I remember that the people keep asking me, give me some, I need some medicine. I have a lot of, fearness. And this is also one of the things that we have to pay attention when all of us with the crisis. But if we're talking about the future, so what I think is what I try to say, that the international community needs to understand, as I said, there is no borders in this issue. Collaboration is so important. Innovation, disaster response, and other. We as Israelis, and I agree with you, Mr. President, when you said that small countries sometimes need much more support. So we understand that if, God forbid, someone in Egypt ill with the COVID, it affects us. So we have to be care about it. So if, and because of that, we have to collaborate with our neighbors, with our international community, which is so, so imperative in this issue.
Thank you so much, really. So, Mr. Dossal, as someone leading a forum that fosters global partnerships, what do you believe are the most effective strategies for ensuring that resource mobilization and sustainable financing become a reality in a global health security, and how can these be aligned with broader international efforts? Please.
Thank you, sir. Actually, the previous panelists have given some excellent recommendations, particularly on international collaboration. We saw the power of collaboration during COVID, actually. We also saw the failure of collaboration in some cases during COVID. So I just want to stress that that continues to be the primus inter pares if we are to look at better health systems, better health for people. SDG 3 calls for that. It's kind of the preeminent requirement for achieving the SDGs. If a child or an individual doesn't have good health, she or he cannot learn, and therefore cannot earn better, cannot become a member of society. So that's, it has to be the priority, and about 120 governments around the world do not have the resources to do that, unfortunately. So they rely on the Western donors, for example. They rely on bilateral aid. As I started mentioning in the first comment I made, we should turn the problem over its head and make this national ownership of the issue. Israel didn't say, give me money, give me intellectual resources. We know how to do these, but you also know them. So can we share this? There are many countries who are ready and willing and actually do that. But the recipient countries do not have the capacity to accept that. So we need to figure out a way, what I call create national sovereign health funds, where countries can take the lead, countries can benefit from it, create local capacity, even create local capacity for building machinery and so on, so that there's less reliance on foreign inputs, foreign aid, foreign goods coming in. And companies, pharma companies, manufacturing companies are ready to deal with that. They would be very happy because they'll do it under license and they'll get their branding as well. They'll expand the business because they know they cannot sell it to those countries because it's too expensive for them. But if they produce it locally, they can do better. So what we need to think of is what I'd call a partnership-based model. We talked about this, a number of distinguished experts have talked about it. Collaboration does mean partnerships, building relationships. But without resources, you can't achieve them. So you need philanthropy to kick in. You need private capital to flow. You need investment bonds to come in, public-private investment, impact bonds, for example. And a combination of that and sovereign wealth funds to come in and play that role. And once you do that, you are starting to kind of make real inroads, sustainable basis. Well, you mentioned about sustainability, that's key. And we found that by doing these as multi-stakeholder partnerships, you have academic research involved in that, you have private sector involved in that, civil society helping with delivery systems, for example, governments easing up their policy, transparency, but also better accountability, and so on. Today, aid doesn't flow in many countries because we don't know what happens to that aid. So we have to acknowledge that there is corruption, lack of governance. Governments have to change, but so do the providers. And we hope that through that basis, we can start to move the kind of paradigm shift. WHO will not receive funding from the United States. UNESCO will not receive funding from the United States. And other countries have got wind of it and say, I like that. Maybe I'll keep the funds for my own citizens. Then they say, well, I need to do it from what's the diplomacy benefit for my country. All you need is that a dozen other countries to say that, and you're frozen. You have a major North-South divide. So the South has to take the lead, not complain about it, but to say, I can do it. Thank you.
Wow. So cooperation for sure, but also the shifting on paradigm that is necessary. Absolutely, and I think that the audience also understand that. So we go to we are running out of time, but so Yoram Weiss, so Mr. Weiss, considering your organization's commitment to community health, how can we enhance real-time data sharing and surveillance systems to better monitor and respond to emerging health threats? And what role can local institutions play in this global effort?
So thank you for the question, and I'll try to be very brief and precise. We heard a lot about AI, about the dangers of AI. I want to take us a step forward and look at the bright side of AI. And I think that one of the things, and I'm here extrapolating of work that is being done in our institution, I think one of the problems with us as human beings that we're very bad at pattern recognition. We're also very bad at the ability of cross-linking between patients and between different areas. And I think that AI provides us an amazing opportunity for pattern recognition because it allows us to put together information that is both free text, diagnosis, but most importantly, imaging, laboratory data, and treatments all together and to try and analyze it very, very quickly. I think this, combined with cloud computing and quantum computing, can be an amazing tool for early identification of outbursts of any disease, for sure a pandemic, and I think that this is one of the directions we should look at the ability of implementing AI systems. The other part is the treatment. We have today at our hands amazing technologies. People mention here mRNA for the vaccine, but I would like to take a step forward. We have immune modulation techniques. We have today the ability, using AI systems, to three-dimensionally understand the protein of the microbe and to specifically target drugs and also isotopes in order to kill the bug or to kill the cells that are associated with the disease. Having said that, all that can be done with international cooperation during outbreaks and an amazing ability for humanity to allow it to decrease the response time between the outbreak and our response as quickly as possible to save human lives. Thank you.
Thank you very much. I know that we are running out of time. There is a hand there that needs 60-second maximum for a question, but maybe 30.
No problem. First, thank you. There was one thing that was missing from this discussion, and that is the fact that the reason why we have healthcare crisis, because the absolute vast majority of funding to the healthcare crisis goes toward chronic diseases. These chronic diseases are all treated and can be treated through lifestyle changes and diet and exercises. Although we know what is the problem is, doctors and medical healthcare system throughout the world, they handle it through medications rather than handling through education. So in terms of action plan, what I would recommend is in particular Azerbaijan, because of the leadership role you play in the non-aligned movement, is to set up a task force in order to look at the possibility of getting the educational system to focus from the early days of a child going to school to the date that a medical doctor is graduating, to focus on the root cause of the problem rather than just only dealing with the symptom and providing them with medication. Medication is good in one hand, but it's a killer on the other hand. That's my point.
Thank you so much indeed. You have to go.
We have a flight, we have to...
Yes. Just we'll be quick. First of all, remember that after us there are the youth, and they just have to be listened and to be heard, and we have to stay here. Also feel a bit difficult after 3 full days of speaking, but, you know, at least the cherries are there, so we need to eat also the cake. Then, I try to obey for the conclusion to the speaker, above all the first, the second, but all of you cited artificial intelligence. I was not an unpolite moderator when I was tapping here, but I put on ChatGPT some of your words and keywords. So the conclusion of ChatGPT, the number 8 panelists were, thank you all for this enriching discussion. Today, we have not only identified key challenges in global health security, but also explored pathway for stronger collaboration, equitable access, and sustainable solutions. As we move forward, it is crucial to turn these insights into concrete actions. The artificial intelligence is saying with us to concrete action, please. Then thank you, ChatGPT, that reinforce preparedness and resilience at all levels. I appreciate your contribution and engagement, and I hope this conversation continues beyond this room. So thank you very much. Thank you, ChatGPT. Thank you, all of you. And next, we listen to you. Thank you. Family picture, quick, is possible. If